channel. This video is about what all you need in first year as a dental student. The four subjects हैं. Four are the exam going subjects and two are non-exam going subjects. Exam going means कि उनके तुम्हारे theory exam होंगे, practical exams होंगे, and non-exam is just subjects which have a particular work quota that you have to finish. Exam going ones are anatomy, human anatomy and human histology, and then you have physiology, biochemistry, dental anatomy and dental histology. The anatomy and histology comes as a single subject. You just have separate practicals for them. And physiology, biochemistry, they have theory and practical. The non-exam going ones are preclinical prosthodontics and endodontics. So to begin with, your first subject, which is human anatomy, you don't need to do anything. Like literally, it's a medical subject, so you'll have dissection halls to see all the anatomic structures on a cadaver, and you have books like BD Chaurasia, just buy BD Chaurasia. There is third and fourth book which is important for dentistry, which has head and neck anatomy. If you don't want to buy, you can buy the PDF versions. You'll have a total of 3 sessional exams and 1 university exam, which is also called prof exams for some colleges. But yeah, that's all for the exam going subjects. So in anatomy, basically you'll just be taught about head and neck anatomy, what all structures are there, what nerve is it supplied by, what muscles are there, and what is the surgical anatomy for people who are pursuing oral surgery later. It's important for you to like get a grip on your basics. So physiology, for physiology you can buy AKJN. I love that book. That book is really good. If you don't want to buy, you can still download a PDF. But there is AKJN for medical physiology, AKJN for dental physiology. You should buy the dentistry version. For biochemistry, you can use that. There's an author called Dr. Satyanarayan. You can use that book for dentistry. But if you want to use the medical ones like Harper, you can use it as a reference book. And then you have dental anatomy. Dental anatomy, there is for anatomy a book called Wheeler's. And for histology, there's a book called Albans. You can study separately from these books. They are good. They are like the standard books for dental anatomy and histology. But if you find them difficult because the language of English authors is a little tricky to understand, then you can use Maji Jose. It's a Indian author. You can use that book for anatomy and histology both. For preclinical prosthodontics and endodontics, don't buy any books right now. Buy it in second year. If you need it, just download a PDF. And for even for the exam going subjects, if you don't want to buy a book, just download a PDF. PDF is also enough. Also, make sure to buy the latest edition for all these books because sometimes some topics are newly added and they can come in your exam. So I got this question a lot, like which is better, an iPad or a laptop? According to me, iPad is a lot better because you can carry it wherever you go. It's more handy and you don't need to spend a lot. Like a laptop, I think it's a little tedious to like charge it, and then it has such a big charger. Tablets with a larger screen, which will give you a laptop wala feeling, but it's more handy. So try to buy an iPad, but if you don't have the budget to buy an iPad, don't worry. It's not a necessity. People like made it such a hype that you need an iPad in college. No, it's okay. Even I don't have an iPad. I have a Samsung tablet because I have a Samsung phone and I like the ecosystem part of it. So I bought everything from Samsung. You can buy Samsung tablets. They are equally good. It's not bad. Like people have this stigma about Samsung not being good. It's good. It's not bad. I have used it for like 3 years now and I'm really happy. I have an old laptop. Don't buy a new iPad. It's okay. If you are just buying it, just prefer an iPad or a tablet. Don't buy a laptop because it's a waste of money. And every day just try to make notes. Try to like listen to the class. If you are not making notes, just listen to the class or take your PDF in your tablets and mark what topics they are teaching, because not every topic is important. There are some topics which are of more relevance than the others. So try to only mark the topics which are important, because not even if you study harder, it won't give you the results. So you should study smarter. Just mark the topics which have been taught, because they will ask questions even in vivas, even in the theory exams, from the part they have taught, not from the part which is given in the book. But don't try to cram up things or try to unnecessarily work hard because it won't pay off. I have done that first and second year and I feel stupid. You should work smarter, not harder. It's not 90s. It will only pay off if you work smarter because everyone is working smarter. Now going to the practical part of it. For human anatomy, if you guys have dissection halls, if they are showing you the cadavers, all the anatomic structures, well and good, you will need a pair of tweezers to see and a box of gloves. DH will have a glove box, but if you don't see a glove box there, so you might need to get your own gloves, which we did. So you should buy a pack of powdered gloves or non-powdered, depending on what you like. Non-powdered are a little better than the powdered ones because they like fully powder ho jata hai yahan pe. If you don't get masks there, you can also buy masks because there is a lot of formalin and that smell, it goes to your head, you start feeling dizzy. So please make sure to eat before going to the dissection hall. The teachers will show you this is that structure, this is that structure, and then they will tell you to like come and see on your own, and then you can see it. And then you might have spotter exams later, which is a part of their internal assessment. So they will just tie that structure and then ask you which nerve is it, which muscle is it, what is the attachment, what is the insertion. If you Physiology is all about body fluids and how the body is working, what respiration is going on, all that part. So for physiology, you will need lancets. Buy a group of lancets depending on when you have your blood wala practicals, and they'll just tell you to prick yourself and then put it on a glass slide and then count the RBCs, count the WBC. Biochemistry. Biochemistry is all about what carbohydrates, what protein are there, what composition of the urine sample you are getting, this and that, and saliva sample. Your college will give you some samples and then they'll teach you what reagent is to be applied in first one, second one, third one, what result will come, and that's how you will learn. Chemistry lab, just color changing, you will understand what is present, what is not. Dental anatomy practical, you need wax blocks, you need a chisel, and you need scale and a divider. Please don't lose your chisels and a divider and the scale. Everyone loses it. I have lost it 3 times. Carve out the anatomy of each tooth on a wax block, which is like this big wax block. You have to carve the full anatomy with the crown and the root, and that's how they'll grade you on that. Histology, they'll show you the slides, tell you to draw. Even in human histology, in dental histology, they'll just show you the slides, tell you to draw it with the HNE pencil. You have seen the pink and purple colored pencils. They'll check it, and then in exams also, there will be a slide, you just have to draw it. You'll get like 2 minutes to draw each, identify and draw. This prosto and endo, they are with you till final year because their exam is in final year. Pre-clinical exams are in second year for both the subjects, but their full exam, like the theory exam, it happens in final year. So get better at your skills in prosto and endo because that's what going to help you like later in dentistry also. That summarizes the whole video, what you need in first year. And please make sure to have your breakfast every day, which all of us forget. Even I do. Until now, I don't eat breakfast and it makes my head hurt a lot. But yeah, you should have it. You should. Even my dad told me to eat breakfast every day, but I don't because I think, no, I'll be late. But eating breakfast is really important. You don't want to faint. I have seen a lot of people fainting because they don't have breakfast and it's really bad. So have breakfast and go to class.
समझ रहे हो?
I don't know how this turned into a motivation channel, but yeah, that's how it is. Bye guys, see you in the next video.